Hello, and welcome to this week's episode of Giant's Healthy Innovators Live TV. My name is Barry Shrier, and I'm your host. To begin with, we'd like to thank the many tens of thousands of viewers that we get from around the world dialing into these weekly episodes. Thank you to all of you, and we invite you always to make contact with us. We'd love to hear from you, and we're always interested in your views about what additional content to put into these weekly TV shows. These episodes of Healthy Innovators Live TV are sponsored by Giant Health. Please go to the Giant website, www.giant.health, where you can learn more about us. We're a global community of nearly 200,000 people. Our informal strapline is we work with everybody whose business is healthcare, technology, and innovation. So we'd love to hear from you. We'd also like to announce that we have coming up in 2 weeks' time, the European Health Tech Innovation Week, which is coming from the 17th to the 21st of May. This is 5 one-day events taking place in Liverpool, Berlin, Stockholm, Paris, and Barcelona. Each day, we have an incredibly packed agenda full of extremely interesting and successful healthcare innovators, academics, investors, and clinicians. So don't hesitate to join us. Your Health Tech Week on the 21st of May. Taking place both live and in the real world in Liverpool, England, and also virtually, so everybody can participate remotely from around the world. This week, I'm extremely pleased to introduce you to my contact, Chris Wasden. Hello, Chris. How are you?
Hello, good.
Chris, great to see you, and thank you very much for joining us. You've had an incredibly interesting journey, and we're very keen to hear about your entire successful career. But in particular, we want to talk about the biggest challenges in healthcare to begin with, and some of the biggest challenges in society. And obviously, we know that you've been involved in digital therapeutics, so we'd love to ask you, what's an example of a big challenge in healthcare, and what can digital therapeutics do to address this?
Yeah, I think when we look at the largest challenge in healthcare, it's that the vast majority of the healthcare problems and healthcare costs we experience as a society and as a world are really within our own control and are of our own making. If you look at the impact that our lack of exercise, our dietary habits have, our sleep habits have on our health, both mental and physical, these are things of our own making. I did a study recently where I looked to see if the world was that much different today than it was in 1900.
Right.
Because I looked around at my kids and all my kids' friends, and it seemed like mental health problems and physical health problems were significantly greater for my kids' generation than for my generation. So I said, well, let me take it back to the turn of the last century and see if things are different. And what you find is that things like divorce levels are 15 times higher than they were there. The amount of sleep we get is 1/3 less today than we got in 1900. If you look at the amount of exercise and activity that we get, it's half as much. If you look at the number of calories we consume, it's about 50% more. If you look at other sort of social factors, such as people being raised in one-parent families, that's, again, about 10 times what it used to be. So the world today is a lot different than it was 100, 120 years ago.
Yes.
And one of those manifestations actually is in things like in 1900, there were significantly less than like 25% of people were overweight and almost nobody was obese.
Right.
And now over 1/3 of people are obese and 1/3 of people are overweight. So again, a huge, huge change. And so when we see these significant increases in mental health problems,
yes,
as well as the fact that 70% of all healthcare costs are spent on chronic conditions, things that really didn't exist in 1900.
Right.
We see that these things are all a function of the modern lifestyle and the modern way that we experience our health, and we hurt our health through these different behaviors and habits. So given that as the context, that we have created our own health problems, which have these costs and outcomes that are tied to them, the question is, how do we change those behaviors? And so what we're focused on at Happify and other digital therapeutic companies particularly is using these new digital technologies in ways that can improve behavior change towards behaviors that are healthier.
Okay.
I was speaking at a medical conference many years ago with hundreds of physicians, and I was talking about this topic.
Yes.
I said, by show of hands, how many of you took a course in medical school on human behavior change? Not one hand went up. The reality is that physicians don't know the first thing about behavior change. And the physicians might see you once a year for an annual physical, or if you have a chronic condition, they might see you every 6 months or maybe every quarter. Seeing you once a year, once a quarter will never change your behavior. So we have a health system now that was designed and developed at the turn of the last century for infectious diseases. It was never designed and developed for chronic diseases. We now have modern life that has transformed our way of living and our behaviors that have created all these chronic conditions and chronic condition-related costs.
Right.
And yet we still have an infrastructure for infectious disease, not chronic disease. And we are not doing things that we need to do to change our healthcare quality of life and lifestyle.
Chris, this is extremely interesting, and looking forward to hearing a lot more about it during this discussion. I think just for this discussion, if I can play devil's advocate gently, you're talking about the transition over the past 100 years, and you cited some statistics, which I don't disagree with at all, the rise in obesity and this type of thing. But I thought that due to modern healthcare, we're all living longer, healthier lives, and that we're not all dropping dead at age 10 from the plague, or we're not living for 4 decades with severe toothache and this type of thing. Am I wrong, or am I confusing a couple issues here?
Yeah, so what's happened is a couple of things. One is that you're right, we used to die from oftentimes very simple things, right, in the past. And so what modern medicine has done is it has enabled many of the things that used to kill us to no longer kill us. They might make us sick for a short period of time and then we can recover. You've got some modern miracles with different sort of medications, with surgery and things like that, and imaging technology. That's great. But concurrent with all of that remarkable work, we've had these changes in lifestyle which create problems that we never had before.
Okay.
Again, when you look at the comorbidity of mental health distress to different sorts of diseases, we do a lot of work in multiple sclerosis, for example. Half of those patients have major depressive disorder. We do a lot of work in rheumatoid arthritis. Those patients have major issues with anxiety and stress. And those things are significantly greater, like orders of magnitude, not 5% worse, not 10% worse, 5 times, 10 times higher than they were 100 years ago. And those things are comorbid, and they exacerbate these underlying diseases.
Right.
And what happens also is that because of modern technology, we live long enough to get things that will kill us later in life. For example, it used to be that men didn't die of prostate cancer because something else got them beforehand. And now if you live long enough, every man will have prostate cancer. And so they'll get that. So yeah, healthcare is a modern miracle. What we do with treating these disorders is miraculous in many ways, and it does increase our life expectancy. But if you compare this across countries, I've lived in Asia for many years. Lived in Korea, visited Japan many times, and lived in Taiwan and visited China a lot. In Japan, where they have the highest life expectancy for both men and women, you don't see the levels of obesity and people being overweight there that you see in our country. And consequently, you don't see the same level of chronic disease in that country that you see in this country. And so we see that, in countries that have been able to maintain their historical cultures and values around things that pertain to health, they don't have the same level of disease, and they live longer in those countries than we do in our own. And in our country, in the United States, and we have lots of unique problems, it seems like, versus others. But our life expectancy is tapped out, right? It's actually declined in the last couple of years. and it's not improving.
That is quite extraordinary for what is arguably the world's richest economy and one of the more developed nations on Earth. So, Chris, we're looking at this and we're talking about some of the big challenges as society has evolved over the past 100 years and the healthcare and wellness implications. How can digital therapies or digital interventions actually make a difference? If you could help some of our listeners who might not have as technical of a background as others, surely a necessary medical intervention is surgery or a pill or an X-ray to identify what's wrong. What can you give us a bit of a background and framework for the digital ecosystem and the interventions there, please?
Sure. This goes back to what I mentioned earlier, which is that most of our healthcare problems are of our own making. And as a result of that, they can be unmade.
Okay.
And if we unmake them, then we don't need to have as many pills. We don't need to have as many surgeries. We don't need to have as many of these other interventions because we've been able to prevent and to manage our healthcare in such a way that these things don't happen. So I'll give you a few examples. I have a friend who started a digital therapeutic company in the area of diabetes. They did a study that showed that the digital therapy for diabetes that they developed is more effective than the most effective drug. Wow. So you may ask yourself, how can a digital therapy be more effective than the most effective drug in regulating blood glucose?
Yes, exactly.
Right? It's because high levels of blood glucose are a behavior problem, right? You weren't born with this as a problem. You developed it over time through your habits. And so what their therapy does is it educates you with regards to the need for exercise and sleep and diet, and helps you choose the right sort of foods at the right time of day. For example, part of our problem with eating is we not only eat too much food, we eat poor quality food. Here in a rich country, right, we eat foods that are full of sugar, full of fats, are not whole foods. They're not whole grains. They're not whole fruits. They're not whole vegetables. And so what his therapy does is it's something that you use daily to be more mindful about what you eat, when you eat, how you eat. And as a result of that, over the course of a couple of months, your blood glucose level now will improve more than it will with the drug. And here's the added benefit.
Right.
The drugs all have side effects.
Of course.
Drugs work for everybody.
Yes.
The drugs don't create habits that when you stop taking the drug, you'll still be okay. Whereas when we teach people skills through digital therapies, through daily interventions, developing habits and skills, these things are lifelong skills.
Yes.
And once you learn these skills and apply these skills, the benefits of the digital therapy go on for the rest of your life.
Yes.
Even if you stop using the digital therapy, if you have the habit and the skills that you've developed, they go on. Whereas you stop taking the diabetic drug and the benefits disappear.
That's a very good point. That's quite profound, isn't it?
And so that's the real difference here, is that with digital therapy, our phones are something that sit in our pockets and we pull them out, depending on the person, between 100 to 200 times per day.
Yes.
They can alert us, remind us. They're our window into the answer to every question we've ever had in our lives, which we can get instantaneously.
Yes.
And so what we do is we leverage this ubiquitous technology to provide people education, guidance. Fundamentally, what we're doing is we're changing people's values. We're changing people's beliefs. We're changing how people feel.
Right.
We're changing how people act. And by doing those things now, we can address the issues that are driving healthcare costs. And by so doing now, we can have people have better health outcomes. They can feel better. They can live more full and productive lives. And they can have a better overall well-being.
Quite an impressive situation. The diabetes business, could you tell us the name of that company? Because I'm sure our listeners would find that extremely interesting and love to learn more.
Sure. So the company I referred to is called WellDoc, WELLDOC. But there's a number of companies out there that do similar things. You've got Livongo, you've got Omada. We have our own program going on with the diabetes pharmaceutical manufacturing company, because if patients have poor mental health, they're significantly less likely to take their medication. They're less likely to change their behavior.
Right.
They're less likely to follow their doctor's orders. And so what we focus on is providing a number of therapeutic interventions over the course of 6 months that will help you change your sleep patterns, your dietary behaviors, your controlling and managing of your mental health and your thoughts around worry and anxiety and depressive symptoms.
Yes.
So there's this intersection, if you will, between mental health and physical health is constant and applies across all diseases. And it's both a trigger to disease as well as the result from disease.
Okay.
And so managing mental health in our way that we approach the digital therapeutic marketplace is a foundational therapeutic condition that if you help people better manage their mental health, then it helps them manage other aspects of their health as well.
No, that's quite profound, and I can see the vastness of the challenge here and the vastness of the opportunity as well. Chris, again, can you help our listeners who might not understand the difference here? Often we have heard people talk about the health apps community, the ecosystem for apps that you can put onto your smartphone that are in the greater health and wellness ecosystem. I heard recently there's over 400,000 health and wellness apps out there. And I think often a criticism of them is that it's a bit of a wild west out there, and that, of course, you can collect a few students who may be in the basement of their university dormitory, can knock up a wellness app over a weekend. What's the difference between all of that, these wellness apps that maybe play the music of whales singing to help you relax and sleep at night? What's the difference between that and a digital therapy, a real DTX solution?
Mm-hmm. Yes, I've had a lot of firsthand experience with that with one of my previous lives. I've had many lives. I feel like a cat. I've had 9 lives. But
okay.
Yeah, well, one of those is I ran a digital therapeutic incubator at the University of Utah, where the University of Utah is rather unique. It has a business school, it has a medical school, but it also has one of the top 2 video game development and design schools in the United States as well.
Wow. Oh, I didn't know that.
So I'd bring those 3 schools together, and we would get hundreds of students across the world to design apps that would make you healthy. And what I saw firsthand from that is that it is, to your point, it is easy to get students to design some great ideas, to make an app that can look very interesting. But here's the problem. Something that somebody creates in their basement and tests on a couple of students is not medical grade.
No.
The students graduate from college, they go off on their separate ways. So who's going to maintain this app once it's made?
Okay.
You've got the issue of where's the science that shows that it's effective? Where's the clinical trial?
Sure.
Tested on hundreds of patients or thousands of patients, right? Where's the infrastructure that's required to meet HIPAA, GDPR, high trust, all the other standards that are necessary? Where's the quality management system that meets the FDA's GMP requirements or the ISO 1345 requirements?
Right.
So when you look at these 400,000 apps that are out there, I would say, based on my own analysis of those, 99% of those lack all the things that I just mentioned. They lack any evidence that there's any science behind what they do that works.
Okay.
They lack a quality management system to show that they're being developed and operated in a way that meets quality standards for safety and efficacy.
Mm-hmm.
They lack any sort of meaningful testing of the product to show through clinical trials, placebo-controlled, double-blinded, that they actually work. They lack the organization behind it to make sure that it is able to continue to come up with version 2, version 3, version 4. Because
Yes.
software, unlike a drug, actually, with a drug, it's once and done, right? You develop the drug, you test the drug, you get it FDA approved, and then for the next 20 years until the patent expires, you never change the drug.
I see.
Software's never done.
Mhm.
You're always creating the next version of your software.
Yes.
You find bugs, you find ways to improve it, and things like that. And so these apps that are out there that are done by somebody in their basement or their garage don't have any of that. And so they're basically garbage.
Okay.
Right? There's no evidence that anybody should ever download them and use them. And the reality is most people don't. If you look at the statistics on these apps, over 90% of these apps are never used a second time. They're downloaded and used once, and then after that, people abandon them and they move on to something else.
I understand.
So what we focus on a lot as a company, and this goes back to our roots as a company,
Yes.
we focus on patient engagement.
Okay.
So how do you actually design an app that uses behavioral economics, game mechanics, game principles, things that we know work in the video game arena to create these very sticky experiences that people come back to again and again.
Yes.
And not just teenage boys, right? So if you look at the different type of game genres, middle-aged women are actually one of the highest users of video games out there. So how do you create those sort of experiences so that you have adherence to the therapy that is at least as equal to or greater than what you find with drugs? And so on average, drug adherence is about 40%. What we find with our therapies is that unlike most apps that people download and use once, with our therapies, we have over 50% of people still using them a year later.
Wow. Wow. Well, that's profound. Quite a big difference, isn't it? So very interesting statistic, Chris. Thank you for sharing that. Tell us more about Happify, please, and your involvement with Happify, and what do you guys have coming up over the next year or two?
Yeah, so Happify, we've been around about 8 years, founded by 2 video game developers that were highly successful in creating a video game platform that used this science of engagement I referred to just a minute ago.
Yes.
And they, after finding that they were responsible for people wasting billions and billions of hours of their lives playing meaningless video games, they decided that they wanted to focus their time and attention on things that are more important.
Sure.
So they decided, they sold that business where they had 60 million unique monthly users and decided to take that experience and this science of engagement out to solve a real problem.
Okay.
And they chose mental health as that problem to solve. They linked up with a graduate student who had gotten her PhD in positive psychology at University of Pennsylvania. And with that began to look at all the literature of the evidence that supports cognitive behavior therapy, mindfulness, other sort of behavioral interventions to treat and manage diseases, focused primarily initially on mental health and expanding to others.
Yes.
And with that, launched a business that became Happify. And then over the course of the 8 years, we've had over 5 million people use our therapy.
Wow.
We have the largest health plans in the United States today offering our products to 20 million of their members.
Extraordinary.
We have some of the largest, we've got 7 of the 20 largest pharma companies in the world that are our customers, where we're providing products for their patients on their drug therapies.
Okay.
So we're involved in migraine, rheumatoid arthritis, MS, diabetes, psoriasis, cardiovascular disease, and some others.
Yes.
And our business, if you look at what we do versus other companies in the digital therapeutic space, we are far and away the broadest in our approach to this. So we have 3 businesses. Most companies really only have one.
Sure.
We have a direct consumer business that provides free products to patients around specific diseases like psoriasis, where we provide community support, clinical support, education, tracking tools, things that help patients better manage their experience with psoriasis, as an example.
Okay.
We have a enterprise business that provides 9 different products to employers, health plans. We've got most of the largest tech companies in the United States that are our customers.
Oh, nice.
We've got, as I mentioned, the largest health plans that are our customers. And for those tech and other companies that are our customers, they are generally global companies. And so they're providing our products to their global employee population. And that's because our products are in 10 different languages.
Nice.
So we have culturally adapted as well as translated all of our products into those different languages so that their employees in China or Japan or Spain or France or Canadian French, so up in Montreal, can use our products.
Okay.
So that's our enterprise business. And then we have our pharmaceutical business, or a specialty pharmacy area. And in that, and that's the part of the business that I run, we provide products that will address the mental health comorbidity of specific diseases, as well as the symptoms of that disease. So as an example, we have a relationship with Sanofi that we announced a couple of years ago. Through that, we developed a product for multiple sclerosis. As we were developing that product, we found that we could not only improve the symptoms of anxiety and depression, but we could also improve the symptoms of fatigue for those patients by focusing on interventions around exercise, diet, and sleep. And so we're not only now addressing those symptoms of anxiety and depression, but also fatigue, which is one of the primary biomarkers of MS as a disease, and for which there's no existing drugs for MS patients to take. Right? And the same is then true in these other areas that we focus on. So we as a company now have an array of products and services that apply different revenue and business models.
Yes.
That are distributed through multi-channels.
Yes.
To patients, to employers, to employees, to members of health plans, et cetera, that address patients everywhere along their journey with the disease, all the way from mild to moderate to severe.
Yes. Extraordinary. It's an amazing success story, and I love to hear about it. Thank you for sharing that, Chris. With regard to the, what do you call it, the division that you're involved in, Happify's relationship with the pharma sector, what are their challenges that they cannot solve themselves? Why aren't they doing this instead of collaborating with you, for example?
So they've tried. Right? I mean, if you're a big pharma company, you've got multi-billion-dollar budgets, you've got lots of smart people that work for you. If you look at the journey of pharma companies, so prior to this life, so 2 lives ago, I was the global healthcare innovation leader at PwC.
Okay.
And this was after the launch of the iPhone. So I started there in 2007.
Okay.
And I led their innovation effort with the pharma industry for about 7 years. And during that time, I focused on the application of digital technologies. In fact, the first report that they co-authored was called Healthcare Unwired.
Right.
We were focused on how the unwiring of healthcare would enable us to do all the things that I talked about around changing behaviors and providing therapeutic interventions and whatnot.
Yes.
And I would work with the largest pharma companies on this. What I found is that the pharma companies are not designed by their very nature to be able to create and sustain and support a digital therapy.
Okay.
You know, their wiring is to take 10 years to develop a drug, whereas a digital therapy could actually be developed, at least the way that we do it, could be developed in 6 to 12 months, not 10 years, right?
Right.
And then they take it through a clinical trial that generally costs tens of billions to hundreds of billions of dollars.
Yes.
Well, even the most expensive clinical trials that we're involved in cost $5 million, right? They don't cost anywhere close to what it costs a pharma company.
Sure.
And then once the product is developed, they're basically done. And then it's all about commercial marketing, right? Because once an FDA approval is received for a drug, you don't change the drug.
No.
Whereas for a digital therapy, again, you're never done. You're always changing it. You're always improving it. So, I compare this to a digital therapy companies like a hummingbird, right? Our wings flap really fast. We have a heart rate of 1,000 beats per minute. A pharmaceutical company is like an elephant.
Okay.
Right? Their heart beats at 40 beats per minute. They eat different things. They move at different paces. And so what you found is that after pharma companies spent hundreds of millions of dollars
Yes.
trying to develop digital therapies themselves, all of it resulted in failure.
Oh, seriously?
Yeah.
There has to be a success story out there. There must be a big global pharma company.
Yeah, once you find it, call me. Tell me about it. I'd love to hear about it. All right. So
I believe you, but I'm really surprised to hear that.
But again, it's not surprising when you look at what is a digital therapy versus what is a drug. It's just so different. The other thing that you have to appreciate is that the pressure on pharmaceutical companies has not been as intense as it needs to be with regards to gathering data to support their drugs. So if you talk to payers about what their biggest challenges is with pharmaceutical companies, is that half of all drugs that are prescribed are never taken. Okay. And so patients have these drugs sitting on their shelves that have never been used, but they paid for. The health plans paid for them, right? But they're never used.
Yes.
And drugs that are never used obviously provide no benefit
Of course.
to patients. And the other thing is that half of all drugs that are used aren't effective for that patient because of the unique biology or chemistry of that patient, that this drug doesn't work. And so the patient needs to go out and find a different drug. So the pharma companies are paying for drugs that actually don't work as well, right? And then even the ones that might work can create such side effects that the patient's well-being is actually not better off, but worse off after taking the drug, right?
Yes.
So what's happened now is that the payers, governments as well as private payers, are increasingly providing pressure on the pharmaceutical companies to deliver evidence that their drugs are taken, that they're effective, and that they improve overall quality of life. And there's no technology that exists in the world that will enable them to get that data through a pill. There was one aborted effort with Proteus Digital to try to do something like that by putting a chip on a pill, but that didn't work so well.
No.
So what's happened is the payers now are putting pressure on the pharma companies to collect those 3 data points to justify the reimbursement of the drugs.
Right.
And the pharma companies have spent decades trying to figure out how to do this digital stuff and never succeeded. So instead, what the pharma companies have finally begun to do in the last 5 years is to work with companies like Happify that are good at making apps that are of high quality based upon science, that are highly engaging, that get people to come back again and again, that deliver outcomes that can be measured on a regular basis. Because putting our digital therapy with their drug therapy as either a complement or a companion or a combination enables them to gather the data that they need to justify where they are in the formulary, to justify where they are with regards to reimbursement. So that's really the game changer that we've seen in the last 5 years. Companies admitting that their digital investments have not gone well. And then the COVID pandemic has just reinforced this, because we saw for many months the sales reps couldn't get in to see doctors, doctors couldn't see patients. And so the only thing people were doing were using their phones, right? And their computers, but mostly their phones.
Yes.
So that phone was always with them. So if there was a way to deliver the therapy via the phone, and if there was a way to do the diagnostics through the phone, and follow up with the patient through the phone, that was the only lifeline that these had. And so it's got the pharma companies to increasingly focus now on what they can do using digital technology. And they've reached out to many companies like Happify to enable them to do that.
That's a very insightful, Chris. Thank you. So do I understand correctly? It's a necessary, what do you want to call it, symbiotic ecosystem here, rather than, would you say 10 years from now, we're not going to see the pharma industry eating the digital therapeutics industry or doing it themselves, but continuing to grow this the symbiotic relationship based on the quite profound differences in the DNA of these organizations?
So it's hard to say 10 years from now, and I'll give you a couple of reasons why that's hard to say.
Okay.
So if you look at the emergence of every new technology that has impacted the pharmaceutical industry, the existing players of the industry were skeptical and resilient and reluctant to participate in those technologies when they were first birthed. All right. Okay. So if you look at the small molecule pharmaceutical companies, when biologics came out, none of them got on the biologic, wagon train or whatever, bus.
Yeah.
They all stood on the sidelines. They watched what happened. It was too risky for them. They weren't sure it was ever going to be able to scale. It was a complex manufacturing process. It wasn't like making a small molecule pill, which is a very standardized process through standardized manufacturing. And then after the biologic companies proved that they were effective and safe and could be scaled, then the larger companies acquired the biologic companies. And so Sanofi acquired Genzyme, right? Roche acquired Genentech. And you saw that play out again and again, where these big companies didn't enter the market early on. And in fact, they waited over 10 years before they even got into the market, and they got in the market through acquisition.
Sure.
You see the same thing going on in gene therapy right now, right? The biggest pharma companies are really not doing gene therapy. They're acquiring gene therapy that others have done.
Yes.
So one question that is outstanding on digital therapy is, while they have not been successful at doing digital therapies themselves, will they acquire the digital therapy companies once those companies have shown that they can scale?
Okay.
Right. Now, the problem with that is that digital therapy is more different from traditional pharmaceuticals than gene therapy or biologics are with traditional pharmaceuticals.
Understood.
So acquiring a digital therapy company and not killing it will be a much more difficult exercise than acquiring a gene therapy or a biologic company.
Yes. Yes.
So I think that's one issue. The other issue is that the more likely acquirers of digital therapeutic companies in the next 5 to 10 years are probably not pharmaceutical companies at all. They're probably companies like Amazon or United Healthcare or Teladoc, which you saw the Teladoc-Livongo merger, right?
That's right.
And so, these digital therapy companies could become part of other large digital technology companies, such that the pharmaceutical companies will never be able to acquire them.
So in those circumstances, like with the Amazon example, would the acquirer be doing this simply to gain the opportunity to help the health of their own staff, like the original Haven concept, or is this quite different?
Yeah, if you look at Amazon's ambition, right, for the first almost 20 years of their, well, actually for about the first 20 years of their life as a company, they did virtually nothing in 25% of the economy, which is healthcare.
Okay.
All right. And so they said, look, there's 25% of the economy that we don't participate in.
Yeah.
And we could bring our disruptive technology approach to that part of the economy as well. Let's do it. And so they acquired PillPack, right? And so now they provide pharmaceutical products at scale on a national basis through that. They're doing their own clinics now with their own employees, but that's actually a stepping stone and a staging ground to do it for everybody. Mm-hmm. And they've actually started to open this up in Seattle and other areas to other people. You see the same thing going on with Walmart and others. So yes, the ambitions of a Amazon are to be a major player in 25% of the economy.
Okay.
And they will do it through every means. And so when you look at, what is digital therapeutics analogous to in other areas of disruption for a company like Amazon? So Amazon started out with analog books, right? Paper books. Then they went to audiobooks through acquisition. Then they invented the Kindle Fire, and then they provided digital books, right? And now, most of their books that they're selling are not analog books at all. They're digital books. They're either digital audio or digital, Fire type of books. And so then they said, well, we did that there. There's another physical medium called movies. They're being distributed through VCRs. They're being distributed through CDs. Okay, well, we can do that. And then they moved into producing that sort of content.
Yes.
Right? Distributing it through streaming, so digital, right?
Mm.
And if you think about both books and videos, those are activities that you will spend hours doing on a daily basis, right?
Mm.
So it's not that far of a stretch for them to say, well, digital therapeutics are digital media content. And it's content that you need to do for 15 to 30 minutes a day, just like you watch a TV show or you read a book.
Yes.
We can distribute it through our existing pipes.
Yes.
With Amazon Web Services as the cloud backend for it. We can create new engaging genres of this sort of video and digital content for therapies, and we can distribute it, through our existing channels. So it's actually very similar to what they already do. Okay. It adds some elements that they're not used to doing, which is the regulated parts, right? So they're not used to having FDA, excuse me. They're not used to having things on an FDA quality management system and platform, but they're a big company, they're a smart company, they've got lots of resources, they can do that.
Sure.
They're clearly willing to make that sort of a commitment when it comes to PillPack and being a pharmacy distributor through national networks and pharmacies. So they can do all that. So that's their ambition in healthcare. It's not their employees. I mean, that's a starting point. But what they do is their employees are, again, if you will, they're kind of the guinea pig where they try this stuff out, and if it works there, then they scale it to the world.
Yeah, exactly. Well, Chris, that's a very interesting observation and an interesting look at the history of what's happened with pharma and their acquisitions and their development, like you said, from small molecule to biologics and gene therapy, and the difference between that and the entire digital ecosystem. Very, very interesting. Thank you for sharing that. I'm sorry to say we're running out of time, which is quite a shame, because I wish, Chris, you and I were sitting in the pub together right now, and I could buy another beer and we could talk for another hour or two. This has by far been one of the more interesting conversations we've had in a very long time. So I'm extremely grateful to you for sharing all this intelligent and information and valuable and interesting insights and experiences. We're just going to wrap up then, Chris, if that's okay.
Sure.
Anything you want to talk to our audience about regarding Happify? Do you guys have any asks to our community? Anything you want to announce, or anything else coming up that you'd like to talk about briefly?
We've had a number of important announcements recently. We just closed on a $73 million round of financing.
Oh, congratulations.
So that was a big deal. That we raised more in this last round than we raised cumulatively over the previous 8 years. So
wow, congratulations. Who are the investors?
So Deerfield is the lead investor on this one, and then we had some of our previous investors participate, as well as a few other new ones.
Excellent.
But Deerfield's an iconic name in healthcare technology and investing.
Yes.
We've also, as a result of that capital raising, been hiring aggressively. So when I joined the company about 3.5 years ago, and I've been working with Happify for about 5 years.
Okay.
The company had in the U.S., 20-ish, 25 employees.
Oh, wow.
We'll end this year with 200 employees in the United States and probably around 100, 150 in Europe.
Nice.
So, we are growing very rapidly. So one of the asks is, if you have a passion for helping people with their healthcare related problems, come join us.
Yes.
We've got lots of open positions. We're actually hiring a lot of people that sometimes started their career in healthcare, left it to go do something else, and are dissatisfied because of the lack of purpose and mission in what they do today.
Okay.
And they want to go back to healthcare.
Oh, interesting.
And use what they learned in other areas. So, yeah, check out our website. We have our positions posted there. Reach out to people. Reach out to me. Let me know. I'd love to connect you with those in our organizations that are responsible for hiring.
Sure. Well, we'd love to do whatever we can to help and promote that, and ideally to bring you some top quality candidates applying to those vacancies.
That'd be great.
Good stuff. Hey, well, look, Chris, I really enjoyed speaking with you, and we're proud to have you on this week's episode of Giants Healthy Innovators Live TV. Obviously, we wish you every luck in the future. I'm sure you're going to continue with the incredibly interesting and successful career that you've had already, and we're very keen to keep in touch with you. So on behalf of everybody in the Giant Health family and our greater healthcare innovation ecosystem, thank you very much.
Thank you. Enjoyed it.
Yeah, thank you, Chris. And I'd also like to thank all of our sponsors for Giants Healthy Innovators Live TV and the Giant Health Program. I'd like to thank Eagle Lab. Thank you very much. We love working with this. Thanks also, of course, to Vodafone Business. And we're very grateful to one of our newest partners, McKinsey & Company, who are Giant Health's knowledge partner. So thank you to all of our sponsors. We really love working with you guys and proud to have you on board as important collaborators. I'd also like to thank our sponsor and media partner, Startups Magazine. And if I can tell you very briefly a little more information about Startups Magazine, if you're looking for more stories from inspirational entrepreneurs, check out the Serial Entrepreneur from Startups Magazine. It's a print and digital publication that champions tech startups. Here, their editor, Anna Flockett, interviews the most innovative startups from the moment with some startup lessons and failure fables, as well as a sprinkling of inspirational advice. You can find them by searching for The Serial Entrepreneur in any streaming service or by going directly to the website, which is startupsmagazine.co.uk. So thank you very much to Startups Magazine for your sponsorship. Once again, we love working with you guys and we're grateful for your support. And lastly, once again, thank you to Chris Wasden from Happify. Thank you very much to Happify for your sponsorship of the Giant Health event last year, and we'd love to collaborate with you further this year. And so it was great to have you on board, Chris, and good luck with everything you're doing. Lastly, My name is Barry Shrier. I'm the founder and chief executive of Giant Health. We invite everybody to come and participate in this year's episode of the European Health Tech Innovation Week, which is taking place in 2 weeks' time from the 17th to the 21st of May. This is 5 one-day events across all of Europe, showcasing the leading innovations in healthcare and tech innovation with a special focus on digital therapeutics. So that's 5 one-day conferences taking place in Liverpool, Barcelona, Paris, Berlin, and Stockholm. And you can learn more about that from our website, www.giant.health. We hope to see you there. Thank you very much.